So this is your suprasternal notch, and this is the sternoclavicular joint. And if you go down here, this is the clavicular shaft. And then you reach the acromioclavicular joint, and right here is your acromion process. And when you go a little lower, you hit the coracoid process. And this is the head of the humerus. And all along here is the shaft of the humerus. And as Sarah relaxes her arm here, you can feel the greater tuberosity of the humerus. And if she goes into external rotation, you can feel the lesser tuberosity of the humerus. And now we've got the pectoralis major right here that Sarah is going to push on my arm here in horizontal adduction, and you can feel the muscle right there. And we've also got the biceps right here. So the long head of the biceps goes through the bicipital groove to attach onto the supraspinous fossa of the scapula. And you've also got the deltoid muscle, you've also got the deltoid tuberosity right here, and the deltoid attaches right, the middle deltoid attaches right, or goes right here to the deltoid tuberosity. And then if you go just inwards a bit, you've got your anterior deltoid and your posterior deltoid back here. You have the spine of the scapula, and as you go down, you can feel the inferior angle right here. The inferior angle has the teres major that runs along here, and you can feel that when Sarah internally rotates, just right here. And then right above that is teres minor, which you can feel when she externally rotates, just along here. And then right below the spine of the scapula here is the infraspinatus, and you can feel also when she externally rotates, right there. And then right above the spine of the scapula is the supraspinatus, and that muscle you can feel when she abducts her arm upwards. All right, and now when she brings her elbow straight in extension, you can feel the triceps right here. And then as she shrugs her shoulders upwards, you've got your upper traps, and as she brings them back together, you've got her middle traps, along with the rhomboid major that goes from T2 to T5 to the lateral medial border of the scapula. And then as she brings them down, you've got your lower traps right along here. And then as she brings her arms into adduction and extension, you can feel her latissimus dorsi in through here. And as she protracts her shoulders, you can feel the serratus anterior that go along here and that attach onto the ribs. Great. This is the medial epicondyle. And then here is the ulnar collateral ligament right here. On this side over here, you've got the lateral epicondyle and the radial collateral ligament. Right here is the radial head that you can feel when she pronates and supinates. And then back here you've got the olecranon, and you've got the ulna that runs all along here. Right, and here's the cubital fossa, and you can feel when she flexes. Yep. So you've got the brachioradialis, and on the back of her arm here when she extends, you've got the triceps that run onto the olecranon. And so you've also got the flexor carpi ulnaris that you can feel when she ulnar deviates, that comes along here. And then you've got the palmaris longus, you can feel when she brings her thumb and pinky together and flexes, that runs all along here. And then you can feel the flexor carpi radialis when she flexes and radially deviates all along here. On the posterior side, you've got the so you've also got the pronator teres that you can feel right here when she pronates. Yep. And then on the back here, you've got the extensor carpi radialis that you can feel when she extends and radially deviates. And then you've also got the brevis and the longus. So the brevis runs from the lateral epicondyle down, whereas the longus runs from just above the lateral epicondyle and then goes down. And then you've got the extensor carpi ulnaris that runs along here. And if she relaxes and just extends her fingers, you've got the extensor digitorum that runs down here. So this is the ulnar nerve that passes right in through here. And then these are the metacarpals here and here. And these are the metacarpophalangeal collateral ligaments that go on either side right here on the knuckles. And then you've got your phalanges that are here. And then you've got your interphalangeal collateral ligaments that run on the side here of each phalange. And then, when she brings her thumb into extension, you've got the anatomical snuff box, and the scaphoid bone sits right in that snuff box there. And then on the palmar side, you've got the pisiform, a little bone that sticks out, and in line with the third digit at the bottom here, you've got the the lunate bone. And right above the pisiform, just about here, you've got the hamate. And when she brings her thumb and her pinky together, you've got the opponent's pollicis muscle right here. When she abducts her thumb, you've got the abductor pollicis brevis. And when she flexes it, you've got the the flexor pollicis brevis. And you've got the central compartment along here, and the hypothenar compartment just along here. This is the the first metatarsophalangeal joint. This is the first metatarsal. Underneath here, you've got the sesamoid bones. As you continue right here, you've got the first cuneiform just below the first metatarsal. And then you've got the navicular bone right here. And underneath in here, you've got the sustentaculum tali. Here is the medial malleolus. The calcaneus is right here, and up along here is the tibial shaft. And then coming in through here is the deltoid ligament. Underneath here is the plantar fascia. The flexor hallucis longus comes along here. You can feel it when she presses down. And then right along here is the flexor digitorum longus. You can feel also when you press there. This is the Achilles tendon. And if she plantar flexes, keeping her knees straight, you can feel the gastrocnemius muscle. And when she plantar flexes and bends her knee, you can feel the soleus muscle. And then when she dorsiflexes, you can feel the tibialis anterior just right along here. This over here, you can feel the tibialis posterior pulse on the bone on the medial malleolus there. And then you've got the base of the four lateral metatarsal, the heads of the four lateral metatarsals. And then you've got the fifth metatarsophalangeal joint right here. And then the fifth metatarsal. Right here is the base of the fifth. And then right in here, you can feel the cuboid bone. And then right here is the lateral malleolus and the fibular shaft that comes up here. And then right in here is the sinus tarsi. And you can feel the talar dome right in through here. Here is the calcaneofibular ligament right here. Here is the posterior talofibular ligament and the anterior talofibular ligament. And then you've also got, when you plantar flex and evert, you can feel the peroneal muscles. So the peroneus longus and brevis pass through here. The longus goes under the foot and the brevis attaches here. And then when you dorsiflex and evert, you can feel the peroneus tertius that comes in through the front here. And then right back here, you've also got the common peroneal nerve. When she extends her toes, you can feel the extensor digitorum longus right here, and the extensor retinaculum passes right along here. And then when she extends her big toe, you can feel the extensor hallucis longus right here. And then you've also got the dorsopedis pulse, which is just right on top right here. Oh, and then you've also got the anterior inferior tibiofibular ligament that passes right here. So here's the patella. Here is the medial condyle of the femur, and here alongside is the medial collateral ligament, the medial tibial plateau just here, and you've also got the medial joint line and the medial meniscus. Right here, you've got the tibial tuberosity, just here where the patellar tendon attaches onto. And then lateral, you've got your lateral condyle of the femur, the lateral collateral ligament, and the lateral joint line, and the lateral meniscus. Right below, you've got the fibular head. And then you've also, on this medial side here, you've got the pes anserinus that comes in down here. It contains the gracilis, sartorius, and semitendinosus. And the pes anserinus bursa is just here. Right above your patella, you've got the suprapatella bursa. And then right along here, when Sarah adducts her leg, you can feel the gracilis muscle. And then the ITB band, iliotibial tract, is just along here. When Sarah flexes the hip and extends the knee, you can feel the rectus femoris muscle coming along here, the vastus medialis and the vastus lateralis, and the quadricep tendon that they all attach to comes in right here. You've got the medial patellar retinaculum right here and the lateral patellar retinaculum right there. Right. So this is the popliteal fossa. When Sarah bends her knee and extends her hip, you can feel the semitendinosus muscle right here. And then over here, a little bit underneath and medial, is the semimembranosus. And then right over here, also originating from the ischial tuberosity, is the biceps femoris.